All right, good morning, everyone. Good morning, good morning. I'm so glad to see y'all are already talking to each other. That's wonderful. Hopefully a few more people will show up. And my name is Jenny Calhoun. I'm your host today. And we have some great things ready for you for the rest of the morning. Welcome, welcome, welcome to our second Mpox training for healthcare providers here in Charlottesville, representing the Central and Northwest regions. And I am a nurse consultant for the Division of Disease Prevention. I work primarily in HIV prevention. I spent most of my nursing career as a local health district nurse. I heard someone talk about how wonderful it is to be an STD senior nurse, and those are some of my favorite days, for sure, for sure. And here we are, there's still things going on that are making clinical life complicated, epi life complicated. We want to share with you some important things about Mpox and why we can't take it off our radar. We've got some great speakers planned for you, and I got a little bit of housekeeping to do, so let's see what we got. Well, this is what I'm doing now. So let me tell you about the rest of our planning group. We've got Dr. Lauren Lee, who'll be presenting after me. She's up here up front. She works on our health information team. We have Donald Moore from the Office of Emergency Preparedness. He is our training coordinator and has done a wonderful job getting everything together and making sure that our slides work and the rooms are ready. Please make sure that you enjoy the refreshments in the back. We have Dr. Safri Diawara, who also works with me in the Division of Disease Prevention. He works primarily in HIV care services, and he'll be moderating the panel discussion a little later. And then in between those two things, we'll have two clinical speakers here from the Charlottesville area. So I'll look forward to introducing to them when they get here. We also have in the audience Angie West, who is our Central Region epidemiologist. She'll be on the panel. And also Dr. Katie Kirkchin, who is one of our Doctor of Veterinary Medicines in the Division of Surveillance and Investigation. So they'll be on the panel as well. If you haven't signed in already, please make sure you do. That's the way you're going to get your credits if you're going to apply for credits today. And as far as emergency exits, the door that you came in is probably the closest. If there happens to be something between us and that door, if you go out the door and take a right in the hallway, at the end there are some service doors that will take you to a service entrance to your right, and that will also take you out to the parking lot. As far as restrooms, thanks to me, there was a toilet overflow situation. Luckily, that occurred early, and hopefully the women's room is open again. There's also the men's room that right across from the lobby or the front desk. If by chance it's not available, there are bathrooms in the exact same place downstairs, and the stairs are right when you walked in. They're really pretty spiral steps that take you down to where the pool is. Again, help yourself to the morning refreshments. If you haven't already, if you have the opportunity and you can take a break from your cell phone, please turn it off. But I know many of y'all don't have that option, so at least turn it on either silent or vibrate. And again, if you do want to get your credits, make sure you'll be getting an evaluation at the end, and make sure that you turn it in by February 7th. That's the deadline to be able to get your credits. And we really do appreciate your evaluation. We learned a lot from our first training. And hopefully some of the changes we made will make today's a little bit better for y'all, but the first one was great. Not as good as this one though, because y'all weren't here. A couple of slides I need to go over that are for CME purposes. I need to acknowledge that there's no commercial support for this activity, no in-kind support for this activity, and that there are no exhibits supporting this activity, whatever all that means. And then for the planning committee, the other two people that aren't here with us today are Susie Silverstein and Sue Skidmore. They've been important with helping us plan. None of us have anything to disclose. As far as our presenting faculties, Dr. Akira Shishido is currently working for BioNTech, which is one of the manufacturers of vaccine. And he was also a lead for the STOMP trial, which is related to TPOXX treatment. And then our other speaker, Dr. Rebecca Dillingham, does not have anything to disclose. So what our day is going to look like right now, we're doing the opening remarks and introductions. Then next we'll have Dr. Lauren Lee do an Mpox overview. Dr. Dillingham will do Mpox vaccination. We'll take a 15-minute break. We'll come back to see Dr. Shishido in Mpox testing and treatment. Then we'll have the exciting roundtable where you'll have a chance to ask any questions. And I hopefully you'll take that opportunity to share any of your experiences with Mpox. as well, because we really like to hear what's going on with the people that have boots on the ground. Then we'll have our final remarks and adjourn. I did want to let you know on the back table, we have a sampling of our Mpox materials that are available at no cost for you. And feel free to take as much as you want back there. The more you take, the less I have to take back with me. There is a sampling in the back of some Spanish and English materials. Some of the materials are also available in other languages. So if you do want to order anything, we've got the palm cards that are up in the right side of the screen. And then we've got what you need to know about Mpox and how you can prevent the spread. And also, I meant to say too that these slides will be available to you after the presentation. And the speakers will also be recorded. We won't be able to record the panel discussion, but you'll have the opportunity to listen or have some of your coworkers listen if there's something that you found was particularly interesting or riveting. We have some additional materials on our website, or the Red Cap survey, integrating Mpox vaccination testing and treatment into sexual health and HIV clinical care and how to do that. Also about what vaccines you need, so including the Mpox vaccine as well as a few others that are really important for adults. And then also that was just updated on Monday, there's an Mpox information sheet for healthcare providers. So it will give you the breakdown of all the things that we're going over today in a one-pager. And so you'll be able to tell your colleagues what the situation is, if you don't remember everything that we tell you today. All right, and so I also wanted to say, hang on, Lauren, you're not ready yet. Or you might be, but I'm not. There's also some packets in the back. It's a syphilis provider packet, and I would love for you to take one for yourself and as many as you need for your staff back at the office. As you probably are aware, syphilis has really been in the news. There were some new things out yesterday that we're having the highest rates that we've had since 1950. When I was working at the health department in the late 90s, we thought syphilis was going away, and lo and behold, it's not gone away, and it's gotten worse. And for a while there, it was affecting primarily men who have sex with other men, but now it's affecting heterosexual population as well as women and of childbearing age, and that means that it's affecting the babies. So we're seeing unprecedented rates. We're seeing populations, Black African Americans as well as Native Americans, and they have been just overrepresented in the number of syphilis cases. So we have a lot of work to do with syphilis. So in the packet in the back, there are the 3 most recent colleague letters from our commissioner, Dr. Karen Shelton, about bicillin shortage that we've been experiencing. We're okay with the health department. So as long as someone's coming to the health department, we can definitely get them bicillin. So if you're not working with the health department, make sure you use your health department colleagues to get your people treated. There's also information about the increase in cases of congenital syphilis. The CDC put out some updated syphilis guidelines. There's also a map about where your county falls as far as what the recommended syphilis testing is. There's the most recent Virginia reportable disease list. There's STI screening recommendations. And then there's a really nice syphilis provider packet that has some nice pictures about how to identify syphilis, how to take a sexual history. And then there's information about disseminated gonococcal infection, as well as important information about the disease intervention specialist and how that role can help. And with that, I'll also say that part of the reason for the syphilis increase, they're saying it's multifaceted. Part of the reason is the increase in drug use. And so sometimes, even though people may not want to have sex because they're having drugs, they have sex so that they can get their drugs. So we're seeing an increase in that. We've seen there is controversial information about with the more prevention material options available for HIV, that there's less condom use, so that could be a reason for increase. And then another reason, which definitely COVID hurt us really badly, is there's less offerings for STD clinics, and there's less DIS available to do partner notification and to stop the transmission. And syphilis is one of those diseases that if you can get to people quick enough, you can stop a case from becoming a case. So you can catch it when it's incubating. But it has to be done in a timely fashion. And if it's not, then we've kind of missed the boat and it just multiplies. So with that, I will hand it over to Dr. Lauren Lee.